Hello everyone, Dr. Chris Fox here with the Student Physical Therapist. Today I want to go over segmental mobility testing of the lower cervical spine, so C2 down through C7. Now I recommend that you go back and review the lecture on arthrokinematics of the cervical spine, as the different components of the cervical spine have different rules of arthrokinematics. So what we're focusing on today is C2 down through C7, and because of the facet alignment being in that 45-degree plane, tilted anteriorly, we know that there's ipsilateral coupling. And what I mean by that is when you side bend one way, you naturally get a rotation as well. Or what we could think about, if you side bend to the left, then it's technically getting extension on the left and flexion on the right. Some people will call it closing on the left, opening on the right. But the idea is that you're consistent with your terminology and you just understand what's happening with the arthrokinematics. So there are a couple different ways that you can do segmental mobility assessment. I'm going to go through the more foundational mode first, and then we'll go through the faster, more fluid motion of assessing these joints. So to assess lower cervical flexion, you're going to start by palpating C2 and then C3 spinous process, and you're going to flex them up segment by segment, feeling the motion occurring at each segment until you get to the bottom of the cervical spine. And what you're looking for is just a more difficult amount of motion to get through at a specific segment. For extension, you're going to place your fingers on a specific segment, spinous process, and just lift into a little bit of extension, and then reset their cervical spine, lift at the segment below, reset them back to neutral, lift again, and work your way down. For rotation, you're going to be palpating the cervical spine in the spinous process, and you're going to rotate one direction until you feel the spinous process on the inferior segment begin to rotate contralaterally. So as I rotate his head to the left, I should feel the spinous process kick to the right. And then as you get the motion there, you're going to move further down. Now, because the AA joint has about 45 degrees of rotation, or about half of it, you shouldn't really expect to get a ton of motion occurring down C3 through C7 until you're at least halfway there. For side bending, you're going to palpate the spinous process and then move them into side bend until you feel motion of side bending ipsilaterally on the spinous process, and work your way inferiorly. Now that is the more cumulative way of how to look at segmental mobility testing. You can also just go directly to the facets and do a down glide at each segment. A down glide being where you're palpating the articular pillar and pushing the facet towards the opposite hip. You can look at opening at each segment by palpating the articular pillar and pulling or rotating around towards the contralateral eye. Now there's a whole bunch of different ways to look at it just that way. The simplest way in my mind is just to do side glides. Now the reason why we use side glides is because side bending, as we said before, brings in the motion of extension ipsilaterally and flexion contralaterally. So by working our way through, we can assess a couple of different motions at the same time. Because rotation involves extension and flexion as well, side bending involves them, and then flexion and extension themselves have those components of the different planars of motion. So I'm going to start at C3 there and do a side glide, and all I'm doing is pushing the transverse process contralaterally in a direct planar motion, maybe helping with a little bit of side bend using the other hand. And if I find a restriction at one segment, what that tells me is there can be three possible restrictions. I can have so we're going to say hypothetically, Jim is restricted with a side glide to the left here, which would be right side bending. So hypothetically, I can have three restrictions. I can have extension on the right, I can have flexion on the left, or I can have joints of Luschka restriction. So to differentiate between the facets being left or right, what you can do is, we'll say that it's that side glide to the left. I'm going to bring that segment into a little bit of extension just by providing a little bit of a lift. And then from there, I'm going to do a little bit of a side glide each way again, seeing if it frees up what I was feeling in the neutral line. And if it feels normal, I can say, okay, the extension component or that right transverse process is side gliding fine. If I want to try and bring them up into flexion to that same segment, I'm going to repeat the side glide. And what I recommend is have their head kind of rest on your stomach so they don't use their muscles to try and hold their head up. So I'm going to repeat that side gliding motion. And if it frees up, then I can say that it's not the flexion component on the contralateral side. Typically what you'll see is that one of those is more restricted when you bias it to that side, and then when you bias it the opposite way, it tends to free it up. There are cases where you can have a flexion restriction on one side and an extension restriction on the opposite side, so that both are playing a role with the restricted mobility. Based on your findings, that's going to dictate what you do with your treatment. So if I have an extension restriction on that right side, I'm going to try and address the extension or closing of the facet there. And then if I have a flexion restriction, I'm going to try and address the opening restriction there. And then if it's a combination, I want to address both.